very strange time in our lives and our practices. And as we have been monitoring these webinars and looking at all the opportunities, we have had to learn some new stuff, some head scratching things like, how do we apply for disaster loans and what do we do about unemployment, and all these really, fascinating, interesting, and very challenging things for us to learn from a standpoint of a dentist in practice and a team that's wondering what to do and how's our practice going to come back from this and what's it going to look like and what can we do differently, and actually what can we do in the interim. Because one of the things that's come out in the last couple of days with the CARES Act and the other unemployment information has been that, look, our teams can be working for us. They can be doing things while we're not being able to see patients. There's lots of things that we can do to make sure that when we are allowed to get back into practice, wherever that is in your particular area, in Washington State, we're so far blocked out until May 18th, but we kind of all think it's going to be June. So how are we going to make sure that we can do something straight away when we get back into practice? And the purpose of today's webinar is, what are we going to do for our patients that are currently not being able to breathe very well at nighttime? It's not fair really to tell them, oh, well, we can't put a glove on, or we don't have the right kind of masks, and so go home and sleep badly and breathe badly, and I sure hope you don't get worse during these 2 months. That's not a very good, healthy, medical position to take. So as thankfully, airway management has a resource that we can use, has a treatment plan that we can employ straight away. You have a practice full of people who breathe every night. Some of them breathe just completely normally, don't have any troubles. Others have been diagnosed with a sleep-related breathing disorder of some kind, and they're using their CPAP or they're using their oral appliance, and they have reasons that they might need something else. So the MyTap is a device that we're going to talk about tonight. It's going to allow you to address some of those issues straight away, give you something real practical to use in these next few weeks, something you can rally your team around, something you can get them engaged. If you're able to keep them at work because you've gotten some unemployment relief or some support for your practice and there's cash flow coming in, and so you want to spend it on your team because they're important to you and they're important to your practice, and who else would you like to spend money on besides your family? Is it your team at your office? If you want to give them some money, give them something to do, give them some reason to be productive, help them feel the culture of your office, which is to help your patients. Then let's give you something that you can do that's unique, is challenging a little bit, but the right amount of challenging. It can be kind of fun to give you a chance to be a hero to your patients and to your team. And wow, that sounds great to me. So we put this webinar together to help you get started with MyTap. You may be familiar with MyTap because you've been using them for a while, or you've heard about them, or you've been using tap appliances, you've heard about them in a course, all kinds of things. But let's walk through a bunch of MyTap here tonight and help you see how you can put this great technology to use so that you can get your patients in better care and all those different things. So here's what we're going to talk about. How can you address your patient's need right now? And there is a telemedicine workflow that you can get started in straight away that doesn't require any personal protective equipment or in-office visits. So why not get something going? Why wait until the sleep labs open? In Seattle area where I am, all the sleep labs are closed to patient flow. They're doing telemedicine a little bit, and they're not doing very many sleep tests. And a couple of labs are closed completely. So they can't really address some of our patients' needs. But there are now ways of making sure that that can happen in your practice in ways that can really, really work for you. So I'll talk about MyTap. I said a little bit about that already. We're going to talk about resources. What can you use? What's out there that you can get your team involved in so you can make sure you learn something? If you've been waiting, for example, to get your team started on sleep medicine, you've taken some classes, you're interested, you've done a few, but your team, you really haven't time. You've been too busy for this. Well, let's do something different about that. Let's make sure we can make it work. And there's some billing issues that I can talk about a little bit too to make it easy for you. So let's go through all that. And we'll have some time for questions at the end. So the impact on the patient, on the airway practice by this virus. Well, first of all, we can't see inpatients in most areas of the country. ADA and others have said, well, we shouldn't be doing it at all. In Washington, we're closed out. Many states were closed out completely. And I guess most dentists should be, because we need to reserve those PPE equipment for the hospitals that really, really need them. And since we're going to make a custom appliance eventually for these patients with sleep-related breathing disorders, we got to be able to use scans or impressions to make those custom devices. Well, if we can't see the patient in person, we can't do a custom scan, can we? If we have one on file, we can order an appliance. That's a possibility, but most of us don't really have that capability. I did hear from a colleague of mine who says that one of the things he's doing with all of his patients now is as part of the intake, he's doing a full mouth scan of all of his patients because it's so easy. And so that might be something that comes out of this whole thing, this thing that we can change. Is it, what if part of your new patient evaluation of your ordinary patients in your practice, you took your scanner out and you did a full arch scan? Wouldn't that be kind of great? And then later on, if you did have another emergency like this, you can do something about it. But right now, today, if you don't have those scans or your impressions of your patients, then you can't make a custom appliance. Telemedicine is a very effective way of conducting business with your patients, of getting evaluations done, of having sleep physicians talk to your patients about their airway issues. And there's plenty of resources for that these days, and they're stepping up because they realize they have now a chance to have a big play in the marketplace. They can really make a difference for the population health because of the in-person visits at sleep physicians' offices are curtailed as well. So what's necessary? Is there some way to do this? Of course there is. And so let's talk about that. And that's the MyTap. If you're not familiar with it, let's look at this device for a little bit. You have an arch form, and the arch form is made of thermoplastic material called thermacryl. It's a very special kind of thermacryl, and I'll tell you more about that later on. But it's a white plastic. It fits over your patient's teeth in a very secure and precise way. So it has good retention on your patient's teeth. It has a comfortable fit. It's very small inside the mouth, so it doesn't take up a lot of tongue room, or it doesn't feel rough next to the cheeks. So it's really easy to wear for nearly every patient. It does have a mouth shield, or a lip shield, you can call it. It's a soft silicone piece that slips under the lips and over the post that extrudes from the front of the mouth. That soft silicone shield does a few things. It helps make it comfortable because the post that sticks out has a thread on it. It's a nylon thread, and it's got a smooth plastic surface on one side, but some people's lips don't like the nylon thread. The soft silicone lip shield goes over that, makes that a very smooth way for the lips to seal air around the mouth. More importantly, I think, the soft silicone shield goes under the lips in front of the alveolus, top and bottom. And when it does that, it helps make the patient an obligate nose breather. It kind of doesn't prohibit them from breathing through the mouth, but it sure makes it more resistive. And it's much, much better for our patients to be breathing through their nose. So I love the lip shield because it does make them a nasal breather. And we have to help them with that as well, with some products, sometimes some medications, some habits, those kind of things that we all know how to do. But the lip shield helps promote that excellent nasal breathing habit. And then the MyTap also has an adjustability feature. I mentioned that thread a minute ago. On the MyTap, there's a clear plastic nut that goes over that threaded rod, and that can be used to titrate the lower jaw position, drawing the mandible forward to calibrate the airway behind the tongue to make sure it stays open for the patients to resolve their symptoms at this point, or their apnea if that's what you're treating. So a couple different ways to use that. But we have an adjustable device. We have an adjustable device that it can be made easily to fit over the patient. The patients themselves can boil it and fit it. I'll tell you more about that. And it's something that we can use straight away to help a lot of patients without the need for an impression or scan at this point. So what patients can use a telemedicine protocol? Let's talk about the two categories of patients that you're going to see in your practice. So in your practice now, the ones that are currently on your patient roster, the ones that are going to find you later on. Some of them come in already diagnosed. They've been prescribed for perhaps a CPAP or some other PAP therapy in the past. They're either using it or they're not using it. Most people that have been prescribed a PAP, sadly, aren't using their PAP devices. But a lot of people are, but they want something else as well. The ones that aren't using their PAP devices are really at risk because they know that they've been diagnosed. They know they're not sleeping well. They know the physician has told them that they're at risk for more medical problems if they don't treat it. But yet they've chosen to abandon therapy because the barriers are just too much. Some people are getting concerned because studies are showing right now that PAP devices aerosolize the fluids from the lungs. Well, that's a problem if you're positive for COVID or you're worried that you are. It's a problem for your household. And that's not good. And so people are abandoning their CPAPs just from that. Now, whether they're positive or aerosolizing their viruses, nobody knows. But people are abandoning their CPAPs because they're hearing about this and they want something else to treat it. They may have a polysomnography done, but the data is so out of date that we can't make an appliance straight away for them, even if we could see them and get coverage for insurance. Or it's not medically appropriate because it was 15 years ago or 10 years ago or 5 years ago and their health history has changed. So that we can't get an update of a PSG right now. So it means we have to look for some other way. And then, of course, we always have our patients that are existing with our oral appliances, and yet something's gone wrong. The dog got to it, they broke it, they stepped on it, whatever the case may be, where they need a new appliance, and yet we're unable to do the things that we have to do to make a brand new custom oral appliance. So what are we going to do? Tell them, I'm sorry, you can't treat your airway for 2 more months? No, let's do a MyTab. So those are the diagnosed patients. So what about the undiagnosed patients, the ones who have never been to a sleep physician for a test? They've maybe been in denial about that. You've been talking to them about it in your practice, or you never have talked to them about it, but they've heard about this breathing thing now. And so you're on the phone with them, and I'll talk about that in a bit. Well, you can't get them tested very well. And the people who are worried about their breathing right now don't want to wait. So you're going to be able to give them some solution that will get them treated straight away while we're awaiting more thorough medical issues later on when they're all capable. But there's no reason, there's not any good logic, there's nothing proper medical around telling somebody they have to wait a couple of months just because we can't use our personal protective equipment or it's unsafe to treat them in our offices. So a telemedicine workflow means that you have to connect with your patient via a HIPAA compliant way. Now the HIPAA rules are relaxed a little bit, so you don't have to be too concerned about the details here. But there are some good platforms that you can use in the interim that are actually professional level. I put one down at the bottom. I know a little bit about that company. I'm actually going to use it myself. There are a lot of these companies. Do not take this as an endorsement of DocSeeMe. Get it? DocSeeMe. Get it? Cool. And so don't take this on endorsement, but it might work for you. Certainly you should look at that. So you can connect with your patients, though, by sending out emails, by calling them, by using your social media, using some other outreach from your software that you have with them right now. Who's going to do that? Well, that's going to be your team. So that gives them something to do. You're going to have to get together as a team and write something that says why you're getting in touch with them. What is it that you want to talk to them about or assure them of or offer a new service? The patients in your practice, you might have screened positive before, but you realize they haven't done anything about that. How can you help them right now? Things are different for them. They might be more concerned than they were 6 months ago when you talked to them about that after that screening exam in their hygiene chair. So lots of things you can do, and you can put your team to work on that. Because they're not seeing patients on a flow basis, they'll have time to sit at the computers and they can look at that and still maintain social distance like they're supposed to. You want to use some screening questions, and we know what those are: stop, bang, Epworth Sleepiness Scale, elbow test, those kind of things. You can use the screeners over the phone even for most of those and identify people at risk. And then the dentist then can get on a telemedicine consult with the patient and go through some of the other questions, some of the questions that they might have. So, do a quick exam. Think you can't do much of an exam over the phone? Well, surely you can't gather a lot of data, but you can look at a range of motion. You can ask questions and history questions about TMD issues. You can do more than you might think just on the phone. So why not? Or when I say phone, of course, what I really mean is some kind of a telemedicine platform. Your laptop computer, your phone, your telephone even, your computer from work, your tablet. All kinds of platforms are available for this. So for an undiagnosed patient, you get the patient on the connective. I'm just going to say phone for right now, just as a shortcut, but you understand it's a telemedicine platform. And so you record their chief complaint. What is it, their symptom? What symptom are they trying to fix? For a ton of people, of course, it's snoring. And now that they're home all the time, that might be even more bothersome for folks or some of your families. But it's not always snoring. It could be daytime sleepiness. Could be lots of things that are their chief complaint. A colleague in the industry told me the other day that they did a survey of sleep physicians. And the sleep physician's question was, what do you want from your dentist? What expectations do you have for treating the patients in common with the dentists? And it wasn't about AHI. The answer wasn't about getting their breathing fixed. Their answer wasn't even about keeping their airway open. The first top answer was, do they address my patient's symptoms? Do they help them stop snoring? Do they help them be more alert in the daytime? So make sure you record that. That's also a measure of how we use to see if we're being effective for our patients. So get a list of symptoms and make sure that you write down very carefully what outcomes the patient expects. We can do much of this with MyTap, but if we are less than totally successful with our provisional device, doesn't mean that we're not going to be successful with our more robust custom device, but we can, with some reliability, tell our patients that their symptoms are going to be better. And so how are you going to do the next step? After you've screened this patient, after you talk to them, they say, okay, I want to do something. Got a couple of different pathways you can go. The best pathway is to connect them then with a sleep physician. And again, telemedicine, there's a few sleep test telemedicine solutions on the screen right there. I actually use all of these sleep docs from time to time, and I don't endorse them over every other sleep physician. You should do your own research. But if you're struggling for, well, where should I start? These are offices that I can tell you are run by honest people. And so if you get in touch with them and you deal with them right now to solve the problem right now, you won't be mistreated, in my view. Now later on, you may choose not to use them. I don't really care about that. I don't care that you have that relationship. Let me say it that way. What I care about is what tools can you use right now to get people started. So if you treat a patient, or if you screen a patient and you get them to a sleep physician, you are protecting yourself every way you can for making sure you're doing things the right way. Now for diagnosed patients, it's a little bit simpler because you already have a diagnosis. And so here you can, again, record the chief complaint, make sure that they're very clear about that. And their chief complaint may be different now that they've been treated somewhere along the way, some CPAP, some oral appliance. Interview for the history of the present illness. And so what have they done about it so far? What treatments were successful? Reasons why they are looking now for oral appliance therapy. And then here's another very important part. You want to make sure you explore with them their thoughts about oral appliances if they haven't had one before. If they are wondering about that and they're curious and they're open to having something in their mouth and they're really into it for exploring how I can make this fit and use it myself and make sure I can do something about this for my own health for the next few weeks. Those are the patients you want to see. Actually, I talked to a patient yesterday morning and I was outlining this very process. And he said, man, this is great. I'm kind of into it. I'm excited to be part of this process and put my hands on my device and make it myself and watch the videos and all the things that you'll see about. If you have somebody else who says, oh, I'm not so sure I can do that. I've never been good at that. I don't think I can wear something in my mouth. Well, you want to be careful about who you choose to start on this. Now, I think we should start everybody that has an airway problem. But if the patients aren't going to use it, then you want to make sure you have that good conversation with them over that telemedicine call. You can get insurance information if you want about at this point. It's not really all that necessary. You can. Some of the MyTaps are covered by some insurance companies. That's not the most important part right now. But if you go ahead and get the insurance information, there's a reason why that could be valuable later on to get your practice started when you can see patients. So have them send you a picture of their insurance card front and back, and have your admin people deal with that just like they do on a normal basis. Now, another telemedicine solution that you can do is connect with a local sleep physician. All the ones in my area, for example, like I said, aren't seeing patients right now. I did reach out to a local doctor who is a kind of a freelance doctor. She's not seeing patients on a full-time basis at one of the sleep clinics. And I had a conversation with her about that, and we came to an arrangement to where I could do some marketing of this. I could send out some sleep tests, and she would read them and do the telemedicine with the patients and all kinds of things. And so you can make that arrangement, but you have to get right on it if you're going to make it fast. It may be more difficult to do that locally than it is to do it from one of the online services that's available across the country. If you have a great relationship with a sleep physician and they're wondering what they should be doing with their time right now, this might be a perfect way for you to build that relationship by talking to them about that. The AASM, the sleep physicians, have said that what should be used for home sleep apnea tests should be one-use devices. There's only one on the market. It's called a WatchPat 1. Not really my favorite thing from being from Seattle because you throw it away, but it does have that giant advantage of being a one-use and throw it away kind of a situation. So it's helpful in these days. Most of the sleep doctors I've talked to that are using HSATs right now are going through very strict cleaning protocols. You have to decide if you're comfortable with that. They have, obviously, and their patients have. So it may not be a bad thing, but we do have a disposable device that you can order and use and send out on the physician's order. So what you do there is you have a conversation with the physician after they've had a telemedicine, and the physician orders the sleep test to you. So the physician tells you, please send out a device. That means you're not ordering. So that doesn't put you in foul of your licensure at all. And even in these strange times, we have to be a little careful about that. So then the magic happens now is the MyTap device under your orders is shipped directly to the patient. This is an unusual circumstance. Airway Technologies is making exceptions to their rules about this so that we can get people treated. The dentist is notified by email or some other way that the shipping and what date is going to be delivered so they can touch base with the patient. We've made some YouTube videos. I'll show you a part of one in a minute to help walk the patients through fitting their own MyTap. If you've ever done MyTaps in your offices, you understand how straightforward it is, but there are some tips. So I've recorded some of those that we use in our office every day. I hope that helps you, but you can record your own videos. Use the video that I make and use it to make your own video. That's fine. And just whatever you want to work with for yourself and your patients. Then the dentist or the team member, especially the team member, is available for telemedicine coaching to fit this MyTap. The patients can do this quite well on their own. And then you follow up with a call after that. And then you have a patient who's now taken charge of their health. That's a big positive. Done something real specific for themselves. And now we have a MyTap in place that's doing quite great for their patients. So billing, here's the code. I've heard of some insurance companies that are paying benefits for this. I don't think this is the first thing you should be thinking about. I've also heard of some insurance companies that are playing the old trick that dentistry thinks about when we think about crowns, for example, and how many of you have shied away from ever billing for a provisional crown, even if we had to do it for a long period of time, simply because the insurance companies would try and then, kind of cheat the patient out of paying for the permanent crown. Well, we've heard of that happening for EO485s as well. So make up your own one. I think this should be cash because it's so straightforward. It does make it simple, and the patients just pay you for this. That's the smartest, cleanest thing to do. If they insist on getting it off to the insurance company, then you have to have another conversation with them about whether they should actually get any benefits from that and the risk that the insurance company may invoke the same and similar rule that they're doing for CPAPs and CMS, and they'll end up with perhaps with a saying, well, no, we've already paid for one appliance. We're not going to pay for an E0485, for E0486 custom device, even though they're not really comparable. So there's that. But that's where we are. Now, telemedicine codes are completely available to dentists to use for coding for medical insurance. There are even telemedicine codes for teledental codes that you can use, just like every other part of airway therapy, though we kind of tend to think about using this for medicine codes. And we have the typical ones, the 992s that we're familiar with. If they're your patients, of course, the next digit is a 1, and that's an existing patient. And then we have 1 through 5. Now, in a typical dental/medical encounter for treating sleep apnea patients, we always advocate for staying away from the 5-level codes for making claims. Why is that? Because we dentists cannot document enough medical information to qualify for a 5-level code on really anything, on a new patient, not on an existing patient. What we can do, though, however, is we can spend plenty of time with the patients. And so here's the thing you got to do. When you do a telemedicine call with your patient, document carefully how much time you spend on the telemedicine call. Write it down, put it in your notes, put all those things that you're capable of doing. That's and the Doxy product might be helpful for you with that. And then code according to the time that you spend. And these visits are kind of long. I've done a few of them, and so sometimes patients need a lot of hand holding. They're not really quite used to that. You don't have the ability to read their body language as much on telemedicine. And so they'll ask a lot of questions. You can spend a lot of time on these. Well, good news is you have time right now. So you spend the telemedicine time, document it, and then you can code appropriately for that. So there are these codes to use. The 95 modifier, when your insurance biller does that says it's a telemedicine code. And then we have the O2 code as a place of service. That's kind of a CMS thing for Medicare. And whether you can do this for Medicare or not, it's kind of up in the air right now. So that's not as important as the 95 modifier. It does a C. So there's some things that you can use, some codes that you and your biller can use. Now, if you decide to use a billing service to package all this up nice and neat, well, then you can do that. You don't even have to worry about any of these things. And why would you do it this way? Why would you use a billing service? Because if you gather up information and you have your patients that are willingly using an oral appliance, they don't want to wait, so they're getting a MyTap, and then you want to make them a custom device later on, so their MyTap becomes a backup device. Well, guess what? If you've gathered their insurance information, you've got a telemedicine consult, they've done a diagnosis, well, then you can do all the paperwork that's in advance of a custom device before you ever see them in your office. You can have the benefit check done, you can have the pre-authorization done, you can do all of those things. And then when the patient walks into your office the first day, you take the scan, you do the impressions, and off you go, and they have a custom device within a couple of weeks. So your sleep medicine part of your practice can actually have a built-up demand of patients waiting to come in and have a custom device made because you took the time to reach out to them and get a MyTap done and made them feel much better during this interim time. And meanwhile, your staff is doing something productive. They're doing the admin things. They're calling the patients. They're doing telemedicine calls on behalf of the office. They're doing all of those things. And so it's a win all the way around that you get to do this. And the patients get a chance to participate in their own health. So why a MyTap? Why not some of the other devices? I mean, you can order lots of sleep apnea appliances on Amazon. You can do lots of things like that. They can get Boil and Bites. There's other kind of provisional appliances. But what's the big deal about MyTap? Well, I'm a big fan of MyTap because I grew up using taps. When I started my sleep medicine practices, 20 some odd years ago, Dr. Thornton taught me about taps. And I thought, well, what a fantastic device. It holds the jaw forward. It keeps the airway open. It does it better than anything else I could use at the time. And I used a ton of taps. Well, then along comes MyTap because Dr. Thornton is an engineer and a creator and an innovator. And he says, well, we got to do something that we can put in the office, in the mouth right now. And believe me, guys, we're not going to talk about this, but he had some other ideas that weren't near as easy to use as MyTaps. So I use those too. But the MyTap's along now, and it's fantastic because it holds the jaw forward using the same kind of technology that the tap does. When they went to the FDA to say, oh, okay, guys, we need some clearance for this so we can sell this in the marketplace, they said, well, this is a whole lot like your other devices. In fact, you can use some of the same paperwork to get the 510 clearance. That's what is used by manufacturers to allow devices to be sold in the market. So you get your 510K clearance because the technology is about the same. So some of the research that's been done on oral appliances, there's a lot of research out there, but nothing's been done as thoroughly as using tap appliances. There's a whole lot of studies out there, 38, more than 30, I think there's more than 45 now. There's a bunch of them out there that have some peer-reviewed studies that weren't funded by the manufacturer. Dr. Thornton's put plenty of money into taps. Of course he has. It's his company. But the cool part is that other researchers, other sleep professionals, other scientists have said, well, if we're going to test a device to see about airway opening, let's test tap, because other researchers have said it works. Dr. Thornton says it works. And so they tested it, and sure enough, it started working great. And so they've done it with big studies, they've done it with small studies, they've done it with long-term studies, and TAP comes out ahead on a lot of different studies. So you can trust the TAP technology. You can help your patients keep their airway open reliably in ways that are easy for them to manage, and they can certainly make this work out well. So a MyTap pilot trial is being done right now to compare that with a TAP. When they did 10 on 11 patients with a MyTap, they had a pretty good response with just the MyTap. So they're doing it, repeating that with a big study that we can all count on later on. So MyTap's an excellent device. I know you can trust it. It's easy for patients to use. It's one of the best ones for patients to use because it's adjustable. There are other boil and bite devices out there, and it's so difficult for patients to get those to fit right that we can't really trust them near as much. So there's no...
Dr. Gartenson, I'm
Yes.
going to interject real quick. We have a question that might be a good time to answer it now.
Okay.
The question is, if you provide a MyTap using this approach, would you anticipate patients pushing back on a custom device later because they already paid for a device?
Well, they might for a little while, because the MyTap is a wonderful device, but sometimes patients will get tired of the part that sticks out of their lips. They kind of just don't like that part. It's okay for an interim. But I've had patients come back with their MyTap, say, can I have another MyTap? And I make them another MyTap, but I don't have people in them for a whole long time, because they say, well, can I have something that doesn't stick out of my mouth, really? And you can talk to them also about some of the details about some of the custom devices, the Dream Taps, the Tap 3s, the other devices, because they fit that much better. So it's a fine device. You'll have a few patients who might ask, well, can I just stick with this one? And I always say yes, because they'll always come back at some point to get a new one. Well, if I give them a new one, this week, and I open my practice up in June 1st, will they be in the office on June 2nd to get a custom one? Some of them will. Will some of them be in my office on August 2nd or September 2nd or January 2nd to get a custom one? I think they will. So I don't think that's something to be worried about. And if you set your pricing right, then you don't really have to worry about it, because you make a little bit of money on the MyTap. It's not a ton of money, and you have something that's effective for them. It's been a good thing for the practice, and you've made a little bit of money, and you've done nothing but brand yourself as an effective, helpful doctor. So I wouldn't worry too much about that. Yeah, some patients, yes. Most patients, no. I talked about some of these key benefits already, that you don't have to wait on therapy. The mouth shield is my favorite part of the MyTap, and the technology works well to fit a whole lot of different patients really straight away. So that's a good device. So I talked about most of these already, but the biggest one is down at the bottom. No other boil and bite provides this kind of retention and fit and small size. There are some other devices certainly that the patients can boil and fit to their mouth. But I tell you what, I've seen a lot of those over the years, and nobody ever comes in my practice and says, well, I've used this boil and bite and I love it because it fits so great and it fits my teeth and holds my jaw so securely. They don't say those kind of things. They say, I tried it and I think it makes me better. I think I feel better when I wake up. I think I don't snore as much, but I just can't make it fit my mouth as well. And so the MyTap is not that. So it's a good way to avoid those. So I've made some videos. At the end of the presentation tonight, we have some links to all the videos. So you'll get those, Airway Technologies will be happy to supply you these slides, and you'll see links to all the videos. But I just wanted to kind of show you what I put together here, and see, so you can see kind of what I did. So I'm happy you're going to be able to get something to keep your airway open at nighttime. We've sent you a video that is produced by the company that makes your MyTap. Make sure you watch that video at least once, twice, whatever you need. It's pretty straightforward, and this fitting a MyTap is very easy, but you got to make sure you watch the video. This video is done so you have a little bit of extra help, some tips from somebody who's done hundreds and hundreds of MyTaps for people over many, many years. I think this is a fantastic little device. I'm sure you'll be able to use it well, but it does take a little bit of fitting. So what's a key here? Make sure that you have a few things. You need to boil some water. We use a little hot pot like this. You can get it anywhere, but if you don't have one of these, just use a teapot or use a pot on your stove. But it has to be boiling water. When you take the MyTap out of the device, out of the little gray box it comes in rather, then what you'll do is you'll take a clear plastic knob off the front and make sure you can separate the pieces. It's very important that you take the clear plastic knob and you put it back in the gray box, because it's very easy to lose that little clear plastic knob. And if you do, you won't have a MyTap to use at all, because you can't find a replacement. And so put that back in the gray box and take these apart, just like this. Now, as you saw in the video, make sure you boil the upper one first. And so the upper one's easy to put in your mouth. So you put this in boiling water, make sure it's a whole minute. Now, I'm not going to go through that because you just saw it on the video, but I'm going to show you a couple of tips. So after it's all heated up, the video says you put it over the teeth and you make sure it's straight. That's an important part. And once it's in your mouth, it says bite gently onto the MyTap. I want you to bite fairly firmly onto the MyTap with your lower teeth against the warmer upper one. So you bite firmly against the MyTap part, and the video also says do not push against the sides with your fingers. I want to change that too. So when it's warmed in your mouth, lined up straight, biting firmly, take your fingers and just push against the sides of your cheek to make sure this portion right here adapts to the sides of your upper teeth. We want it to kind of grip side to side on your upper arch. So go ahead and do that and leave it in your mouth for a full 3 minutes. That's very important as well. Then when you tease it out of your mouth after it's all nice and firmed up, it won't be completely cool. You put it in some cool water. You don't have to put it in ice water, but cool water is fine. And set that aside while you fit the lower one. Now here's a tip for the lower one. So now you put this in the boiling water, or you boiled water and poured it over this and wait for at least a minute on both upper and lower to make sure that it gets all the way clear. When you go to put the lower one in your mouth, you'll want to make sure you open wide and lift your tongue to the roof of your mouth. So open and just lift your tongue up. So then when you put this in place, your tongue will be on top of this device. Very important about that. If you don't lift your tongue up, then very likely you'll fold over this inside portion here where this is next to your tongue. Don't worry if you do that. I'm going to tell you about that in just a minute. But lift your tongue up, put it in your mouth, and like on the upper one, you bite kind of firmly on it. But now you can't push from the side. That's not really going to help you very much. This one you have to push with your tongue. So it's in your mouth, you're biting on it kind of firmly, not clenching, but kind of firmly. And then take your tongue and just move it side to side to push these little wings here against the sides of your lower teeth. So just move your tongue, not your bite, just your tongue, side to side. Now, if you don't think you can do that, then open a little bit. Take your wet finger and make sure and just rub it next to the insides of those lower teeth. And then after 3 minutes of kind of going back and forth on that, then you can tease it out and put it in the cold water as well. It's important to have a wet finger when you're managing these. It's also important to make sure you don't boil them together, because if you put them together in hot water, they stick to each other. Don't worry, just keep boiling the water. You might have to pull them out together and put them in boiling water, and then they'll separate. So hot water won't do, but boiling water will. Now here's an extra cool tip for working with this material. If you've put it in place and you didn't get it quite right, something folded over, it doesn't fit your teeth very well, for whatever reason, it doesn't work out well, there's a magic part of this. You put it back in the pot that you were boiling the water in and boil it some more. So if you have a stovetop pot, just put it in that and boil it. So as you boil it, you can't hurt it, as you boil, it'll return to this shape. Doesn't do that with hot water. You have to put it in boiling water and wait just a little bit, and you'll see it come back to shape. Don't try and unfold it. Don't take an instrument or a spoon or a fork and pull it open, that kind of thing. Just put it in the water. It'll return to its normal shape, and then take it out, let it cool down a little bit, and then you can put it back in your mouth and try again. And you can do that a bunch of different times. Of course, we're here to help you, so if you need some coaching on this, just give us a call and we'll get in touch with you about that. But I think you'll be able to see how that works out super well that way. If you're having trouble fitting it in your mouth, then you can take a spoon or something and hold your cheek out of the way. Just any way you can kind of work it in there to make sure it lines up over your teeth, and then fit it up over your teeth to make it work well, or fit it over the lower teeth, those kind of things. Those are all little tips you can use for that. Make sure you don't put these together when they're at the same time, when they're sticky or they're clear. So if you fitted the upper one, you got to take that out of your mouth before you fit the lower one. If you don't do that, they'll stick together. And here's something else that you might discover about that lower one. After you make the lower one, every now and then, on some people's arches, they have a little part of it in the back that sticks up. You can see this little portion that sticks up. Sometimes it's a lot bigger than that. It sticks way up here. If you find that's true in your mouth, it might feel uncomfortable later. So if you have a little part on the lower that sticks up like that, then what you do is you just heat up that end of it. So you just put that end of it in hot water and get a little bit soft, and just take some scissors and cut it off. It won't work if you try and cut it when it's not hot, and you don't want to set the whole thing in hot water because you don't need to refit it. But all you got to do is heat up that little section, cut off the part that sticks up, and it'll make it a lot more comfortable for you. Very important little tip right there. So once you've had this all fitted, so it's nice and that cooled down, when you put it over your teeth, it might be very tight because this stuff shrinks a little bit. That's okay. It's actually better to be too tight than too loose. But if it's too tight so it's uncomfortable, then what you do then is just dip it in some warm water and put it in, take it out, put it in, take it out. You can do one at a time or both of them at that point because you're not really heating them up all the way. So you put it in, take it out, put it in, take it out, and that way it'll loosen it, relax the fit just a little bit, and you'll be able to make sure that that works out well for you. So it's pretty simple to make a MyTap that works. It's a little technique parts, but it's really just about doing simple things. Watch the video, watch this video, think about it a little bit, and you'll be able to make a MyTap that'll fit you very well and get a chance to help you breathe really great while we're waiting for a chance to do a custom device, or whether your CPAP is going to work again for you, or whatever reason we're doing a MyTap during this time. So I hope that you like it, and call us if you have any concerns. So that one, that's a part of the video. I did two other sections where I, get rid of that. I did two other sections where I talk about using the AM aligner and how to adjust the device as well. So that's all there. Again, I just put my phone on with some light, and I went through that. You can use that. Feel free to use that. But you can also record your own. Just if you're comfortable making those same tips, do that. Or use mine. It's whatever works for you there. And so for your telemedicine workflow here for your undiagnosed patients, then The dentist gets the patient and refers them to a physician for telemedicine. You get a prescription for the oral appliance. And then the MyTap, again, shipped directly to the patient that fits the MyTap at home, and then they do the titrations that way. Now, this time, normally when we make a custom device with a physician's diagnosis, we have a target. We have an AHI we want to fix. We have an ODI that we want to normalize. But during this time, I don't worry about that. What I want to do is help their symptoms right now. Later on, we'll test them when it's more convenient for everybody later on. Now, the physician will have some input on this, but I'm mostly interested in symptom relief with my MyTaps at this point. Another kind of thinking about this is if you have a patient that's profoundly sleepy and they're still having to drive around a little bit for some reason during this time, then you don't want to wait until the regular sleep doctor can see those patients in a clinic, because that's going to be a couple months from now before they can finally get in. Don't forget that when those sleep doctors do reopen their practices, they're going to have these 2 months or 2.5 months or however long it's going to be. They're going to have those patients to see as well. If it's been a wait in your community to see a sleep doctor, it's going to be an even longer wait. So even more important for telemedicine. And so set up a deal with your telemedicine doctor to see how they want to manage this. Most of them will say, let's just use the MyTap, let's get through this, and we'll pick up the ball and run with it later on. So what a great way to help your patients in the interim instead of making them wait on this kind of thing. So how do you do this? Telemedicine is legal in all 50 states. The rules are even more relaxed now. The ones I happened to put on the screen earlier, and really everybody you talk to is going to have a presence in your state. It's real simple nowadays. Maybe an additional service that you can use later on. You may find that all this work that you've been doing with your local sleep docs is excellent, but you just need more. If you start doing more and more of this in your practice and you call up your local sleep doctor, it's going to be 3 months before they can get in and get a diagnosis. Well, you know what? It's going to be a lot faster to use telemedicine. So that might be something you'll do on a regular basis later on. If it serves your patients better, serves your practice better, well, it might be a solution for you. Now you have a kind of a kickstart of getting this going here. It might, if you decide to use a telemedicine platform in your own office and you're working closely with a local doctor, see which one they're using, because they're all doing this now. I polled all my King County sleep doctors the other day, last Monday. No, today's Tuesday. So it was last week on Wednesday. I called all of them, and all but one of them are using a telemedicine platform. So I know which ones they're using, find the ones they're using, and if you can sign on to that one, well, that could be easy for everybody then, if that's the case in your town. If it's a bunch of different ones, pick one. It's kind of, you have to see what happens best for your type of practice in your type of town that works out best for your patient flow. And then the AASM is also recommending telemedicine. It's recommending these sleep tests. And so it's really working really good if you can pay attention to what they're doing as well, not because they can set the rules, it's because the sleep docs are paying attention to them. And if you are going to be working with the sleep doctors for getting a diagnosis so your patients can be treated properly and with insurance coverage, then it's good to make sure that you're working with the ones that they are comfortable with as well. So what are some key actions? Choose your telemedicine portal. Contact some existing services like the couple that I put right there. Remember, I'm not endorsing them. They are people I trust. Recruit a couple of team members. They're looking for something to do. You're looking for a way to pay them. So remember, we can get grants now to get paid back for the money we pay them. So it's really good. And so they can get started with you. If you already have a sleep champion, let's go with that person. If you don't have one, maybe somebody will emerge as your sleep champion in your office. If you're not familiar with MyTap, let's get one to you straight away. Call up Airway Technologies right away. Order a couple of them for your practice. Use it yourself. Walk yourself through the videos like we're going to provide for you and your patients. And by the way, in that video, I forgot to say this. I'm obviously talking directly to the patient there. Notice I wasn't wearing gloves. I don't like making clinical videos without gloves, but the patients aren't going to use gloves at their house. And so that's what I was trying to kind of make them comfortable with that. That's why I was doing it that way. didn't want them to think that gloves were necessary to handle a MyTap. They're clean when they come out of the box. Then consult with your team and say, what's our best way of reaching out to our current patients? Should we do emails? Should we do some chart identifications and get on the phone and call them and say, well, what are you doing about airway? Remember we talked to you about that. Remember you told us you couldn't use your CPAP. Remember we had a plan, but now does this accelerate our plan? So come up with some creative ways of getting in touch with your patients. Could be fun during this time when they're looking for something to do. They're more bored now than they used to be. And then be sure you gather that insurance information. It's easy to do. Just go ahead and have them send you a picture of their front and back of their medical card, and then you can start the process for pre-authorizations. And then when they do want that custom device, you're ready to go because you've already handled all that kind of paperwork. So I hope you've gotten something out of this tonight. There's some YouTubes that you can go to from Airway Technologies that allow you to see the video you just saw, the other ones I recorded, the common one that we've had for a long time for fitting the MyTap, and then some other things that you can, other resources that you and your team can share that can get you started on this. So I'm happy to answer any questions. I want you to be treating your patients out there with airway issues, making sure that you can do it right. And this is, man, there's not a better way to do that than using MyTap.